So I think I'm going to get going if it's okay with everybody. I see we have a number of people that have joined from the main session. That the number may tick up a little bit, but I think it's good to if we get going. Let me start briefly by introducing myself. I'm Daniel Snander. I'm a senior advisor to the United Nations Development Programme on matters of risk and finance. I want to introduce the panelists, but before I do, can I just go through some housekeeping? So could I just ask, thank you, if we could move the slides on. The first thing that I wanted to mention is that this session is being recorded. So if anybody doesn't want to, if you like, consent to that, then the easiest way not to consent is to stay on mute and not turn your camera on. Otherwise, we're going to assume that you're comfortable with the session being recorded. On the screen right now, you can see some of the instructions to maximize and minimize the presentation or the speakers. You're in control of that yourselves. I also wanted to say that I'm going to try and make this as interactive as possible. I remember the last, if you like, pre-COP in Madrid annual Ensure Resilience Global Partnership Forum, where we did have breakouts with real people in real rooms and had really expansive and interactive discussions. Let's do whatever we possibly can to make that the case here today. So rather than have presentations that present for 45 minutes and then say 15 minutes for questions, I'd like to just say the floor is open to anybody to raise their hand and pose a question using the chat function. I've started a chat there, and feel free to come in either just to introduce yourselves or to ask a question or make a point, and we will try and weave that into the conversation. Can I just have the next slide, please, on the housekeeping? I've mentioned that it's recorded. There's also a chat group with the URL there, www.ensureresilience.org/risk-talk. Feel free to join in the conversation there too. Thank you. So here's the topic, and here's the running order, and here's the team. The topic is heat stress and how we're going to use risk finance to better manage that stress. The team is a stellar one. I'm joined by 4 esteemed colleagues. I have my old friend and colleague, Kathy Boffman-McLeod, who is hi Kathy, who is the SVP at the Atlantic Council, but also importantly, the director of the Arsh Rockefeller Foundation Resilience Center. And she will be kicking us off by essentially putting the issue in context and sharing some contextual words around heat stress, what it means, and why it is an issue that we need to address and we need to look for financing solutions. I'm then going to hand over to another esteemed colleague, Kshitij Gupta, who is with us today. Hi, Kshitij, thanks for waving, who is in India currently, and he is here representing the All India Disaster Mitigation Institute. And he's going to try and make Kathy's opening words more real, if you will, by telling us the situation on the ground and what things look like on a day-to-day basis from a heat stress standpoint, before we then turn it over to 2 colleagues of ours from the START network. I'm honoured to be able to say that I've worked with the START network for a number of years, and they do great work. And we have Claire Harris in London, but we also have Amjad Ahmed, who is in Pakistan, and they're going to be sharing with us some of the work that they've done on early intervention financing for heat stress. And the plan really is to, I'm going to say, breeze through these presentations relatively quickly back to back, and then get into a conversation. But just because we're going through these presentations back to back, it doesn't mean that in the chat you cannot, of course, raise your hand, ask some questions, and we will field them. Most likely, if the individual wants to take them as they go, they're more than welcome to, or most likely we'll wrap them all up and then get into the conversation once we've heard from everybody. I hope that's okay. And without further ado, as they sometimes say, Kathy, would you like to take us away and put this issue in context for us, please?
I would love to. Thank you. Can everybody hear me? All right.
Loud and clear.
Great. Good. Let me ask everyone to do something pretty easy. You see this slide here. There's just a simple dash in the top right corner of the slide. If you could just take it down I want to talk about some things that don't have anything to do with this slide. I'm going to show you a few slides at the end, but I don't want to distract you with this slide. So I am also going to push that button. Okay. Are you all able to do that? I hope so, because I'm going to turn to that in just a second. So good morning, good afternoon, good evening. I am proud to say that the Adrienne R. Rockefeller Foundation Resilience Center is a proud member of Insure Resilience. And I was there at the kickoff at the very first of the program. And I'm just going to admit right at the top, I just love insurance to solve problems. Big fan. And I think about insurance as an approach. And one of the biggest challenges for using risk transfer and all of the pieces and parts of building risk transfer products is the mentality of insurance as a commercial product, which it has been for a long time, and thinking about it as a tool and an approach and something to be blended with other financing. I had the pleasure of encountering Insure Resilience and worked closely with Swiss Re and the government of Quintana Roo in Mexico to build a parametric on it's in its first iteration, a 40-kilometer stretch of the Mesoamerican Reef. In its protection of the $10 billion tourism industry, the reef itself was breaking waves and reducing risk. And so we created a product that would pay out when a certain size storm came and hurt the reef, and it allowed for funding for repairing the reef and other things too. And this session's not about that, but it's a favorite of mine and an example of how all the pieces and parts can come together. And it's now in its third iteration, and it paid out for Hurricane Delta. So that's great. Thank you, Daniel, very much for moderating here. We're very proud to have you as a fellow at the Resilience Center and the Atlantic Council. I want to just lay out some quick things about heat before we get into the risk and finance aspects of it. We talk about, for this session, heat stress, but it's also a shock. And so you have the slow onset of heat, and then you have these big heat waves that are extremely deadly. And by 2100, 75% of the planet will be facing deadly heat waves. You know, that's billions of people. It hits all dimensions. It's a health impact. It's a worker productivity, an economic impact. It's a social and psychosocial impact. And we've got lots of evidence to tell us that kids have a 10% hit to their learning when they're hot at school. I mean, it just goes, the list goes on, but it doesn't go on enough because we don't have enough data, which is one of the points that I want to make about what we need to build the right approaches, risk transfer, financing, everything. We conducted an analysis, and we completed phase 1, and we focused on the US economy to help shape the Biden administration's policies around protecting workers. And we found with Vivid that the impact in worker productivity alone, so there are so many dimensions: tourism, business interruption, morbidity, mortality, I could keep going, but the main focus for us was worker productivity. And what we found is that for 2020, the cost of worker productivity losses in the US alone was, in conservative estimates, $100 billion. By 2030, with a BAU, we would find a business as usual, as for what we have now, 200 billion, and then in 2050, 500 billion. So $500 billion in impact in one dimension alone of heat to the US economy. Our next phase will be working in global cities to really understand in depth how heat as a shock and a stress is impacting economically and socially in some key cities around the world. So heat's killing more people than any other climate-driven hazard, more than hurricanes, fires, floods, drought, all of it. We, 2 years ago, in the end of 2019, pulled together a group of experts from all dimensions and for 3 days convening around extreme heat. What are the gaps? Where's the current work? How can we accelerate that work, build on it? And the main gap is awareness. It's called the silent killer because people aren't aware of it. And it's costing lives, it's costing money, and we believe that there are 4 main areas where we could have big impact. One of them is in risk and finance. So awareness, policy, risk and finance tools, and implementation of evidence-based interventions. We formed the Extreme Heat Resilience Alliance to try to meet those needs. So now 45 plus members. It includes FSD Africa, Swiss Re, the Insurance Development Forum. I think Ekosway Yahin is here today. Sophie Evans from Center for Climate for Disaster Protection, and Annette Detkin, so you all know her well. David Bresh, so all of the very best minds and more around how we think about using risk transfer and insurance approaches to help reduce the risks and impacts of extreme heat. We have also partnered with mayors, and in ERA and with the mayor members and city members, we've launched chief heat officer positions in 3 key places in Miami-Dade County in Florida, in Athens, Greece, and in most recently Freetown, Sierra Leone, with Mayor Yvonne Aki Sawyer. And so these chief heat officers wake up every day thinking about how to protect vulnerable people from heat, stress, and shock. They organize heat health task forces and mobilize current actions better coordinated across government agencies and departments. And we will be looking at the financial aspects of a heat wave and and heat stress. And so when you think about it, how much does it cost to have a heat wave? How much does it cost to get ready for it for a big city or a little city? How much does it cost to go out and go door to door to get people out of unsafe conditions for heat waves? What's the increased cost to your healthcare system? How do you best locate cooling centers? How do you quickly pop them up so that people use them? And there's some evidence that cooling centers don't work. People don't want to go. So make them community centers that are cool. So there are all sorts of techniques, but how much do they cost? And we really don't know. And they're spread across departments. And that's consistent around the world, whether you're in the global south or the global north. And so we want to bring to the conversation, and through our partnership with Ensure Resilience and as the Extreme Heat Resilience Alliance, quickly get to answering some of these questions. And we've had some success in California. The Insurance Commissioner of California, Ricardo Lara, he created a climate insurance working group, and in the recommendations for, and of which I am a member, we recommended a backcasting for an economic understanding of what it costs, an after action report of sorts. And we want to build a template for that, so it's easy and inexpensive for us to begin to build the financial data that's needed for these approaches. So now I will ask you to look at the slide. There's one thing I want to share with you, and I have a specific ask for folks on the line, and that is that we have, in partnership with David Bresh at ETH Zurich, built on his, and at the time he was at Swiss Re, the tool, it's called the Economics of Climate Adaptation, something Annette Detkin knows really well. We have, in partnership with the Swiss Re Foundation, we're in the process of transforming the economics of climate adaptation. Just for the record, it was 5:45 a.m. So I hope you all will understand if I make a few mistakes. We partnered to take the economics of climate adaptation tool, the ECA tool that's built based on Climata, which is a Python-based tool, and make it easy to use, a web interface that is user-friendly with a quick turnaround. And the key pieces that we want for this tool to, include, for the first time, biodiversity, gender, and social vulnerability into the cost curve that's the output. And we've just completed with our partner Chris Fairless, who works with us and with David, we're just about to the beta launch. And my ask of you is that, is this tool of interest to you? I'm going to show you the heat risk, the heat model. We have a tropical cyclone model, and we'll be adding more. But the key thing is understanding the cost of interventions to reduce the risks and impacts of heat, and which of them are most cost effective. And so let me keep moving here. Let's go here. So you can, in this, I'm going to do this really quickly. You can choose the climate scenario that you want to plan for. And then you can specifically look at layers of data, social vulnerability. We're going to put biodiversity and gender in. It depends on your location and your data availability, of course. But this lets you see how many people where are being affected. And I'm just going to keep moving because I want to keep the flow and the momentum going. You can choose what kind of adaptation measure that you will, that is within the scope of your possibility. So are you going to, make the surface lighter, the roof paint it whiter, or a cooling center, or urban greening? And then you can say, what is the cost of that intervention? And then you can see how you can prioritize vulnerable neighborhoods. And then you can get some specifics about what kind of increases you'll see in the climate scenario, and then get into what are those benefits: increasing local biodiversity, increasing property value, et cetera. We did New York because there's lots of data available, but we want to do this for all of our partner cities, and it will be open source, and we'll be providing training for people. So I encourage you, it's going to be easy to use, but we're going to help you too, and it's going to be really useful in the fact that you have a bigger picture of what does that particular intervention or set of interventions, how could it impact your community. So so you can see how many people you can protect with your intervention. And I'm going to just keep rolling because I want to keep the energy up. And I would ask, please be in touch with me if you're interested in being a part of our beta launch of this. And we would love your input, and we can help show how putting your local data into it would help you make better decisions about reducing the risks and impacts of extreme heat to your community. Daniel, thank you very much, and look forward to the next set of conversations and the questions. Thank you.
Kathy, thanks so much for framing that, really helpful. And you asked some questions there about whether what you showed would be useful. And I'm going to say, as we move through the presentations, Kshitij and then Amjad and Claire, feel free to share reflections on what you've heard from Kathy. I just want to take one question really briefly that's come in on the chat, Kathy. You showed New York. I imagine, however, the work that you're doing around the ECA with David Bresch at ETH is global, because I know Climata is global, but I didn't want to answer the question for you.
100% global. This was quick and easy. And this is a rendering of the tool because the web interface isn't done. So this is us mocking up for today so people could get a sense of what it is. So it'll look slightly different, but yes, global, anywhere and everywhere that we can get data. And increasingly, and I should have said, we have also a new member of ERA, Jupiter Intelligence. And so that's helpful to us in thinking about getting data that may not be readily available. And so we're really thinking a lot about how do we get metrics that we can build into this kind of tool that actually helps you make decisions. And yes, Juanita, it does include the Caribbean. So love to chat.
Thank you, Kathy. Thank you for your question. I'm planning to keep them coming, everybody. But Kshitij, would you like to make this more real for us? Having spent your life growing up in India and experiencing heat stress on a daily basis, or an almost daily basis, what does this mean on the ground for you?
Well, I'd love to, Daniel, and thanks for that kind introduction, and many thanks to Kathy too for wonderfully putting the context. It's very early for you, but you were very sharp in pointing out that heat is not only a stress, but it is also a shock. And nobody knows us better than people living in countries of the global south that are always used to living with high temperatures. So we actually dismiss it as, oh, it's just heat, you shouldn't be bothered about it too much, until we hit threshold levels, and when we see and adverse impact happening on human mortality and morbidity. So I've named my session. I hope everybody can see my slides. Yeah.
Yeah.
So I've named my session as the missing insights and lessons on heat wave and extreme heat preparedness. And these insights and lessons are partially drawn from my own experience of working with the All India Disaster Mitigation Institute. And very recently, we also worked on a research paper for the ALNAP network that chalked out some normative as well as operational lessons for humanitarian and development agencies that are trying to address the challenge of extreme heat. So, from my own organization's experience, I'd like to point out that Ahmedabad was perhaps the first city in India way back in 2013 that adopted a heat action plan. This heat action plan was kind of a policy response to an increasing event of extreme heat related deaths that happened 2 years ago when a heat wave hit the city of Ahmedabad. And this was a collaborative effort where the NDRC from the United States and the Ahmedabad Municipal Corporation got together along with some other civil society organizations, ours included, to work on this heat action plan. And it was basically predicated on early warning systems, relaying early warning through improved community engagement of at-risk communities, and also a capacity building of the citywide medical staff to respond to the challenges of increasing morbidity and mortality. So, what lesson did we learn by working with the Ahmedabad Municipal Corporation when the first time this plan was launched? So, two important things came to the fore. The first one was that kids from low income neighborhoods, as Kathy also said, that kids' development is also affected when it's hot, their mental development is affected. So, we kind of focused on kids from low income neighborhoods and slums because they would invariably venture out even in the extreme heat to play despite repeated warnings that were relayed through various media like WhatsApp messages, billboards, and they were all in the vernacular language, and they would end up falling sick. And also, we kind of focused on the large informal economy in Ahmedabad, consisting of street vendors, consisting of daily wagers who work at construction sites, and also focusing on household helps. So, what we came to know was that kids weren't heeding the warnings because their parents weren't home. Both the parents were working in the large informal economy, and they did not have the leeway to skip work on excessively hot days because they weren't protected by any risk transfer mechanism for heat stress. And as I've mentioned before, heat is actually in the policy circles is not actually looked as a real risk. It is starting to change now, but we have disaster based insurances for cyclones, but there is no such thing related to the threat of heat. So, in that event, these poor people cannot actually afford to miss a day's of work because of extreme heat. Since they aren't home, they do not have anybody to control their kids who would later go out on the street and play in the sun and then get sick. So, the learning was to make tailor-made messages for children and also, if possible, pilot some kind of risk transfer mechanisms for the vulnerable community of adults. Um, I'd quickly also like to breeze through some of the lessons that I was talking about for the ALNAP lessons paper. There are too many to cover in this short presentation, but I just like to talk about two or three which are actually related to the theme of today's session. The first one, which is a key lesson in that paper, is focusing on the additional health risks of heat waves in coastal and delta areas. And I'm sure during Claire and Amjad's presentation, this point would be touched upon briefly or like in more detail. But in our research, we also found that it is not only heat, but also humidity, and when they interact together they can have a much more debilitating adverse impact on human health and morbidity. So in that sense, it is very important to focus on the impact of heat waves in coastal and deltaic areas. I'm talking about the subcontinent, where the humidity stress is also too high. And this is because research has shown that even people who are used to living with the excess temperatures can also feel very severely affected by the heat stress at wet bulb temperatures of 32 degrees Celsius, right? Um, the second most important lesson that I wanted to talk about is the importance of focusing on at-risk communities. And I've just outlined what at-risk communities actually mean. It's people who work in the informal sector, people who have no proper access to either the basic amenities of wash, to Medicare, outside the umbrella of social protection because they are like below the tax paying income bracket. So it is very important for humanitarian and development agencies to make programs that are aimed to address the challenges of heat waves, to include them at their core. So these are some two of the lessons that I wanted to highlight. Uh, I know that I'm ending the time that was given to me, so I won't talk about everything. I'd love to take your questions on that. But the last thing that I'd want to say is that the last key lesson is there needs to be a continuous engagement with vulnerable communities. Now, at the expense of sounding facetiously commonsensical, uh, awareness generation and community engagement is a continuous cycle, and it cannot be a one-off thing. That is because if there is no continuous engagement with the community in countries like India that are experienced with living with heat, nobody is going to take the heat risk seriously. They would just dismiss us at something, oh, it is an extremely hot day, you needn't be bothered by that. So there is a need to have a real dialogue and awareness about the threshold levels over which heat stress shouldn't be acceptable. And I think with that, I'd like to end. If there'll be any other questions about this lessons paper or the kind of work that we've done in Ahmedabad, I'd love to take them in the question answers round. Thank you, Daniel. Over to you.
Thank you, Kshitij. Really helpful. And you know what? There's nothing wrong with common sense. And it's common sense for a reason. And there are things that we know, but that we forget or that we don't truly absorb and believe and act on. And I think heat stress is one of those things. And there's nothing quite like somebody bringing the reality to us again. So thank you for sharing. Thank you for foregrounding, as Kathy did, the importance of awareness building. Thank you for foregrounding the importance of community engagement. And thank you for making it real with vulnerable communities and in informal economies, and some cases informal housing communities too. And we mustn't lose sight of essentially the realities that we're dealing with here. Thank you for sharing that. There's been some comments as opposed to questions in the chat. I'll let you perhaps respond in the chat as you see fit, Kshitij. But now I would propose, if it's okay, to hand the floor quickly to Claire and Amjad to talk through what they've been doing specifically in Pakistan to move from, how should I put it, just, and I don't mean to underplay it, building awareness and quantifying the potential impact of the issue, to thinking about how can we actually solve the issue through risk financing. So over to you, Claire, I think, in the first instance.
Thanks, Daniel, and thanks everybody for the presentation so far. They've been super interesting. So myself and Amjad, who's joined me today, will be talking about the Pakistan heatwave system that the START network has been developing over the last couple of years in a number of cities across Pakistan. And we're going to kind of frame how the system's been developed, what it looks like a little bit, and then some of the challenges that we've had in terms of actually implementing an anticipatory risk financing system for heat waves in Pakistan. So just to give you an outline, like I just said, we'll be doing a short introduction, how the system works, how it's been developed, and then the challenges that we've seen and we're working on currently. So disaster risk financing systems at Start Network. The approach that we take is we say they're locally led but globally aggregated. So what that means is that country networks of our members work together to develop scaled preparedness systems for a range of different risks. And in this case, in Pakistan, one of the systems is on heat waves. Different local and international organizations build out contingency plans and budgets for future crisis that can then be aggregated together at scale for financing. And the actions are based on local knowledge and leadership, and the triggered analytics systems are based on local information and local institutional knowledge, but also with some risk transfer standards within that data system to be able to access different kinds of funding for those systems. So essentially the three bits of our risk financing systems are the model, the plan, the fund, essentially to be able to make it work. The system that we use to build out these national preparedness systems is something we call the building blocks. So it's our resource framework that we use. So this framework is outcome based. So it means that every country system will look very different within these blocks. So they, how you fulfill the outcome is very much dependent on what works in Pakistan, what's appropriate, and how the system will work. So we have a collective framework, and if anyone's interested in that framework and the resources that go behind it, I'll be happy to share after the session today. But in Pakistan specifically, I'm going to hand over to Amjad to talk a little bit about how they came together to sort of build this system for heat waves. Amjad.
Thank you, Claire. I would like to say that all those people who are familiar with Start Network, they must be aware that localization is one of the critical and a very key agenda of Start Network, along with the innovative financing solutions, fast funding, anticipatory actions. So following this localization agenda, we have just not approached addressing the heat wave, you can say in a piecemeal manner, but we have tried to make a whole system around it. And we are trying to address it very locally. And for that, we have made a local hub in Pakistan, taking advantage of already very well organized, you can say, NGO community in Pakistan, like PHF, Pakistan Humanitarian Forum, National Humanitarian Network. These networks are already developed and working in Pakistan. We have developed our own network, which is owned by the local organizations, international organization, as well as the government. Because till the time in any disaster risk management system or risk reduction system or emergency response system, the government is not a counterpart, the system is not going to work in the long run. So we have made government our equal stakeholder, our equal shareholder, a counterpart in this whole system. So we think that this hub linked with a Start financing facility at the global level is going to lay a new foundation of a humanitarian system, which will be marked with flexible, readily available funding mechanisms, where people will be able to plan their responses, which will be very locally appropriate and suitable. And these responses to various hazards, which heatwave is included into that, will be done very systematically, including the government as well into it. Over to you, Claire.
Thanks, Amjad. So Amjad mentioned the Start financing facility. So this is essentially where the insurance bit comes in, as we're at issue resilience. So you'll see on the left-hand side of this diagram these steps. So these are our building blocks essentially, and in each country for each peril or risk, our network will build out a system, and then they're able to access financing through the Start financing facility, our new area around that, which is called Start Ready, and that will be launched at COP next week. So you guys will hear about it more, I'm sure, there. Essentially, it means that those risks can be then structured into a layered financing approach, using insurance for the very rare but large-scale events, using funds that are risk pooled for the more moderate events in the middle, and then local reserves for the more stress type financing. So this is how the Start financing facility will work. But to bring us back now to the actual heatwave system. The disaster risk finance program in Pakistan covers heat waves, floods, and droughts. So today we're going to just focus on the heat wave system. The model lead time gives us 4 to 7 days anticipatory window to act ahead of the actual heat wave. The model is deployed in 6 cities with response plans and holders of response plans in each of those cities. And those cities include Sibi, Multan, Lakhana, Jacobad, and Karachi currently. So the heatwave system is a predictable model using the NOAA GFS heat and humidity index with a 4 to 7 day forecast window as well. It basically uses a triggered pilot based on Karachi. Amjad, do you want to come in and cover this?
Yeah, I would like to say that Karachi, as you know, that heat waves are not a common phenomena in Pakistan and India. They have started with the climate change phenomena kicking in slowly and gradually since 2015. And 2015 incident of Karachi, where in the matter of 2 days, 2,000 people lost their lives because of the heat stress. Just in 48 hours, one city, the morgues were full of dead bodies, people affected by the heat wave. So that brings us to a fact that we have to build the heat wave models, and Karachi city already had a heat wave model. So as I was pointing out that the government is equal counterpart in our system. So in Karachi city, we are deploying the system and following the model of the government. While in other places, as Mr. Gupta was pointing out, that heat has to be coupled with the humidity. So we are using the heat index, which is a mixture of heat wave, heat, temperature, humidity, minimum nighttime temperatures, highest daytime temperatures, wind speed, and wind chill as well. So all these factors combined together form a heat index on which we are working in various cities in Pakistan. And what we do is through the Pakistan Hub, we have laid down pre-positioned funds through the start financing facility, and those funds are triggered as soon as the model is triggered and as soon as the threshold is breached, either in Karachi, which is based on the government model, or in other cities where we are observing. Next slide, please. So I would like to highlight here that in Pakistan or India, you can say that starting from March till October is the hottest part of the year. But June, July, and August are the hottest part of the year. This is the time which is marked by extreme heat waves. And we have seen over a period of time from the last 6-7 years that instead of 3 to 4 days heat spikes, these have been continuing, and they have been going on for weeks and weeks, and people have been affected. And especially as Gupta was pointing out, that those people who are socioeconomically at disadvantage and have to go out and work, they are really affected by such prolonged heat spells where they are unable to go out and earn their livelihood. Imagine a country, more than 200 million people, where 40% of the people are living below poverty line. And these 40% of the people, they have to work. They are the construction workers, they are the field workers, they are the farmers, and they are the daily wagers living in urban slums or the most deprived socioeconomic conditions. So they have to go out and work in this prolonged heat stress environment. So they are definitely affected. Next, please. Claire, please, if you would take over.
So I'll just go into a little bit more detail on the heat index. So you can see here the matrix there, and essentially what the heat and humidity index does is it looks at the temperature and then combines with the moisture level in the atmosphere to understand what the actual feeling of heat is on a person. So essentially it's their ability to sweat. So if you imagine the human body is like an engine, as long as it's got water and it's able to sweat, it can keep cooling itself. But the more moisture you have in the air, the harder it is for you to sweat as a human being, and it means that the heat builds up inside the human body. So heat stress can include all of these kinds of symptoms that are in the diagram here: heat stroke, exhaustion, cramps, and obviously there are a number of different vulnerable groups who are often most at risk. So obviously those who are more exposed, like the outdoor workers and stuff, but also those with pre-existing medical conditions, disease burdens, NCDs, and also older people. As they get older, their ability to sweat, their ability of their bodies to cool themselves also puts them at higher risk. So this is an example of our thresholds that we have set for each of the cities. So you can see here, these are not small temperatures. And you can see here the return periods on the table. And so you can see even a 1 in 5 year event in Lahore is 43 degrees for 2 or more days. Now 43 degrees for 2 or more days for just a 1 in 5 year event. I mean, that's still pretty bad, right? Like that's not a small event, even though a 1 in 5 you would consider quite a small event. So you can see these temperatures are quite significant. So I also wanted to draw attention to the case of the city of Sibi. So Sibi is in Balochistan and is a desert city. But unfortunately, we did a lot of skill testing on the model in terms of the forecast accuracy and things like that. And for Sibi, the model was just not accurate enough to do a forecast window for heat wave for Sibi. The data just was not strong enough. So instead, we have a model based on the observed. So it means we can still do a response, just not an anticipatory response. But I think what's difficult about Sibi as well is the absolute extreme heat. So you can see here a readout that we had this season from the meteorological department, 51 degrees in Sibi, and that persisted for a number of weeks at that kind of temperature. So we obviously had an activation of our system there, but the question continues: if we're looking at temperatures of really that level consistently every year, is there a point where, you know, habitability starts to become a question, really, without significant adaptation financing? So essentially, I think most of us on the call will know about these things. So the reason we focused on cities was because of the urban heat island effect, the fact that the construction of the cities, the way they are, enhances the temperature and the humidity within those environments. Low wind speed, high humidity, high nighttime temperatures are all things that have been factored into our analysis and our monitoring of the situation and the threshold setting. Amjad, maybe you could highlight some more of the human impacts in some of the cities.
Yeah, once we designed our interventions and disaster risk financing program, which we have done in 2020 and 2021, for us, the beneficiaries are the people who are the most exposed. And definitely those who are most exposed are the ones who are going to go out in the sun and bear the brunt of the heat. But at the very same time, we have to keep in mind that what are these vulnerabilities which are going to force them out to face the heat. So these are the poor socioeconomic conditions. They are poor people who have to go out, earn their daily wages, because till the time they are not going to earn, they are not going to bring back food to their children. So that is the biggest vulnerability they have. And that put them to the disadvantage. And with that, we have to see theoretically that what capacities do they have. They have very poor socioeconomic conditions. They have got lag to basic amenities of life. Some of them can't even afford electricity or do not have fan at home. And you have to keep in mind that their health status is not such that they can sustain such high temperatures. So all these combined exposure, vulnerability, low capacities put them at a very high risk of being affected by the heat. At the very same time, we have to also keep in mind that the wheat harvesting season in Pakistan is May, June, and July. And that task is mostly taken over by the most disadvantaged group. They go out in the sun, they harvest that wheat crop, and then the paddy plantation, which is done in the highest humidity area, is again which put them at the risk. At the very same time, the people living in the urban slums, it put them at very high risk, and a long electricity shortages in the cities, where people are living in box-like houses which are not accustomed to repel the heat, otherwise absorb the heat and raise the temperatures. Either if they do not go out in the sun, they are exposed to the threat of the heat. And these all aspects coupled together, they affect the people. And we plan our interventions accordingly, according to the local conditions. Over to you, Claire.
Thanks, Amjad. So we've had a number of activations on the system where the threshold has been reached and money's been released under the pilot scheme. So in Karachi in 2020. In the May, we had a major release that went to a local organisation called HANDS. As you can see, it's quite a small release that was required, but the focus of that response was very much awareness raising, getting ahead of the heat wave, telling people it was coming, giving them some time to plan, that they might have, work a little bit less over those days, or, do these types of things. And we also did quite a big evaluative impact analysis on that, using what we call a CAP survey, a knowledge, attitudes and practice evaluation, to see what impact that intervention actually had. A very different intervention was triggered this year in Sibi, which was again a similar disbursement to Care International, which was a 6-week project, which included disbursement of heatwave kits to households, water stations across a number of different areas where there were local workers outside to make sure people were able to stay hydrated. So very different sorts of interventions, and I think a lot of learning on what actually works and what is needed is underway with us at the moment. So some of the challenges that we have on this system: each city will have a different vulnerability and different kind of people at risk, different livelihoods, different heat exposure, different socio-economic conditions. So it means that each response plan needs to be very much localized to what the situation is in that characteristic of those cities. And also what we found really super hard is that there's very little data on the impacts of heat waves anywhere. So one of the things when we were doing the modeling was we wanted to project the number of people at risk from the forecast heat wave. But to do that, we need to know what happened in the past. We looked for hospital emission data, we looked for all kinds of data, but it's just not that available. So it's very difficult to be able to target until we sort of learn as we go, if that makes sense. So that was one of the key challenges. And then just to finish off, I think when we've been looking at kind of the funding around heat waves, and as you've seen, like, it doesn't always take, in an anticipatory and response sense, a huge amount of money. And so I think there's a question for me on, say, a parametric insurance product or something like that, its appropriateness for the heat wave risk, and whether or not the long-term adaptation of infrastructure and social kind of response mechanisms are actually where most of the investment needs to come, still with some kind of triggered response like our system and event for events, but at the same time, it's only ever going to be a sticking plaster essentially on a much bigger problem. So I think, Amjad, you were going to just kind of do a few conclusions before we finish.
Yeah, I would say with experience, we have seen that earlier there were short spells of heat wave, but now with the climate change over the years, we have seen that these heat wave spells have started prolongation. And our interventions are usually designed which trigger in 7 days before the start of any heat wave event, and keep on going for another 7 days, maximum for 14 days. But as Claire was just pointing out, that Sibi, we were winding up and the project was designed for 2 weeks, but the heat wave continued for 3 weeks, and it continued for more than 3 weeks. So these are the challenges, and especially with COVID-19, it's very difficult to expose the humanitarian workers and bring the beneficiaries the amount of help they need. So the direct interaction is sometimes challenging in the COVID restrictions once the accessibility to the beneficiaries is limited. So I would say that awareness raising, long-term solutions like investing in public health system, forestation, and all these socio-economic uplifting of the areas is important to adapt to the situation. But till the time these efforts are going to kick in and take effect, the heat wave, the way and with the speed it is going on in Pakistan, it is going to affect the human beings and the lives of people. And we need to respond to it accordingly. Thank you.
Claire, Amjad, what a double act. You two gave really good presentation there. Thank you very much. That was a tour de force. With an eye on the clock, We've got about 15 minutes left. We've absorbed a lot of information. Our, if you like, 3 stakeholders, 4 individuals have shared a lot. I'd like to get into the detail of the discussion here. One of the things that struck me, if I can just say, from what you shared, Claire and Amjad, was the importance of, and frankly, the lack of data at all scales here, thinking about what it means from a vulnerability standpoint. And I think this echoes some of the things that, that Kathy mentioned. It's under-researched, it's poorly understood. We need to do a lot more work here, not just to understand the problem and the size of the impact, but also therefore to put some financing around it. But rather than me share my reflections, Kathy, if I could bring it to you, seeing as you kicked us off, and you haven't had a chance to comment on what you heard from Kshitij, and then you have the same guilty pleasure as me, which is you really like insurance. So I'm going to see what your response is to what Claire and Amjad said with their anticipatory financing model.
So I think the biggest takeaway, and of course want to leave time for other questions, but the biggest takeaway is this has to be a part, even a small part, when we talk about the product itself or the approach to risk reduction and locally informed and designed programs and investments that are dealing with well, of course, the underlying issue is greenhouse gas emissions, or at least a part of it. We've got the urban heat island effect, and other pieces, and the underlying health condition of the community. But the key thing is, it has to be part of a big picture. And one of the things that we are working toward is that the risk transfer approach is a part of assessing the risk, reducing the risk, figuring out how much it costs to reduce the risk, investing in those long-term pieces, understanding which are most impactful, and then transferring what you can't hold yourself. And there's a lot baked into that, in terms of the data. So I think the big takeaway is that it's a component and it's an approach. And I think we want to be really flexible in the way that we use it. And then there's lots of financial literacy around what it means, and at the community level, yes, but also at the macro level. And then the other thing is the early warning system that seems to come out in both of your remarks, or all 3 of your remarks, really. And you all may know, we think that naming and categorizing these events would be helpful to give them the same weight, and as they are so deadly, that you could create a culture of preparation and knowledge about what it means when they have a category. A certain health outcome would be expected based on that community, and all data dependent, data. So lots of really rich and important learning that you all just shared. Thank you.
Thanks, Kathy. I can see, Kshitij, I can see you nodding as Kathy was speaking. What particularly was resonating?
Not necessarily just regurgitating what Kathy was saying, but also wanting to add something new. So when we talk about risk transfer mechanisms, and it's my very basic understanding, I've only till now worked on risk transfer mechanisms for farmers who've been affected by successive droughts, and for people who've been affected by cyclones living on the Bay of Bengal coast, which is affected by cyclones almost every year. So one of the things that struck me by piloting those insurance products, disaster micro insurance, if you will, was that not a lot of people can afford them, especially amongst the most vulnerable people. Like, despite a lot of engagement with insurance partners and the government also stepping in to actually defray some of the costs of the premiums to be paid, not a lot of people unfortunately can afford them. I'd like to pick the brains of everybody here to understand how can we, this is a wall which we've clearly hit, and this will be a wall which we'll clearly hit when we try to pilot any kind of insurance products, disaster micro insurance products for the risk of extreme heat as well. I'd like to pick everybody's brain in understanding how can we like cross over this wall that we would eventually hit.
Thank you, Kshitij. I'm going to offer a quick perspective and then maybe bring Claire in on that particular point. I think when Kathy was speaking, she said, you know, this is only part of the solution. It's only a component. We can talk. We need to adapt, and we need to finance. We can't do one or the other. And actually, the magic happens when we do both together.
Daniel, we've lost your audio.
Daniel, we've lost your audio.
Daniel,
Daniel,
your audio is,
we can't hear you.
appear to be muted, but we can't hear you.
Something's wrong.
Yeah. So while he's figuring it out, why don't I fill the gap and go right back to, oh, Daniel, go.
Oh, I'm really sorry.
Yep, there you go.
Yeah, there you go.
What happened, but I lost audio. I was just saying adaptation and finance both together is where the magic happens, and then you get the positive interplay between the two. And I think I may have lost my train of thought, but yes, the question really being posed by Kshitij is how do we make the risk financing affordable? And you know, one of the key mechanisms is you bring the risk down, and you bring the risk down by adapting, and the price follows the risk. I think there's another idea that has been discussed in this forum before, and I'd be interested in Claire and others' view on this, which is the role of what used to be called premium subsidies, now sometimes gets called premium financing, where there is, you know, to a degree, a sense in which the beneficiary, whoever they are, which may not be the same as the policyholder, but the beneficiaries has the premiums in some way subsidized, because it is more leveraged to subsidize the premium than it is to pay out through humanitarian means after the fact. So there's some of the mechanisms for keeping the cost down, adapt as well as finance and premium finance. But what do I know? And I'd be interested in Claire's reactions, although I know that Kathy, you were commenting as my audio came back.
Oh, I was just jumping in for you in case you had some work you had to do on your audio. So let others. There's some interesting, funny comments in the chat here.
I think what you're saying, and I think what Kshitij said around like the micro insurance, like people actually having the ability to actually pay for insurance to protect themselves, to not be able to business interruption essentially, but on a like local livelihood scale. You know, how can I afford not to go to work, like because you'll insure yourself not to go to work when, or do less work or something on these days or whatever. But I think, I mean, there's some learning that could come from in the short term anyway, in terms of like a sovereign type of system, but maybe on a city basis or something like that, where essentially a bit like we've set up in or Amjad and his team have set up, not me, in Pakistan, is that essentially you insure the city against a certain size heatwave event, and then in the days before that payout would allow you to do cash transfers to the most vulnerable in the community, so they could, one, not be outside for a couple of days because they've already got the money in place to be able to feed their family for those few days, and two, they're able to buy water and maybe hire, you know, cooling machinery if they need that to keep themselves cool. So that's one of the things we're also looking at. So you saw within the interventions that we had there, they were quite small scale. But if we were to look at kind of for these bigger, more prolonged events, maybe there's an idea around doing a more significant cash transfer program that would enable people to, you know, stay at home. Maybe they wouldn't, maybe they'd pocket the cash and then they'd also work, you know, they might do that, but it at least gives them the option to protect themselves. And that's the important thing, is to give people the option to do things to at the moment there isn't the option because the risk is too high not to work, but we could at least give them that choice. So there's things around that could be possible, I think. And then how much, as the poverty situation maybe improves and wealth levels come up, maybe then there is the possibility of more independent insurance against business interruption and things. But at the same time, right now, where we are, it feels like that something like that can be workable.
Daniel, just one thought on that. I think as the impacts of climate continue to grow and be better understood and quantified, et cetera, I feel like there is more openness to premium support from philanthropy and DFIs in the understanding of how it all goes together, and that you're long-term building some, we need to build financial resilience as well as the physical resilience. And so whether it's micro or mezzanine or macro, paying the premium is part of the journey to understanding how it fits in as that component in this chain of understanding, reducing, investing, transferring, and starting over again. So I feel like the world has changed a little bit, unfortunately, because we're also under siege. And of course, those least having caused the problem, experiencing it in the most, in the most serious and devastating ways.
I think there's definitely something to be said for, how should I put this, experiencing the pain of paying the premiums yourself, right? It's a way of, it's a different kind of pain, but it's a way of making it real. I wondered, Kshitij, whether, well, actually, I'm going to say, if there's anybody on the line, I saw Tuga was on before, but other people from Insure Resilience Global Partnership, I would be very interested in if there is a house view from Insure Resilience Global Partnership on premium subsidies, premium financing, and where, if you will, the literature or the policy is on that particular point. While somebody perhaps from GIZ or Insure Resilience Global Partnership is thinking about an answer to that, let me come back to Kshitij and say, you were the one who posed the question. What do you think about the answers, or what do they make you think?
I particularly liked Kathy's answer, and where she said that philanthropies would need to step in to support in terms of premium support. And I found Claire's answer. I'm sorry, Claire, I wasn't properly paying attention, so I missed that part in your actual presentation. But when you said that you actually insure the city against the payout, an entire city, I think that's a very good approach. I'm sure the amounts are small right now, but they will increase in future. And also, no judgments against people, the poor people who may or may not use those cash transfers to actually stay in, but at least they now have the option. So I'm very happy that that's happening there in Pakistan.
Daniel, Tuga has raised her hand.
Go for it, Tuga.
Thank you so much. I've been listening and learning a lot. I think heat is increasingly becoming a very interesting topic for us, and it's really great to see what innovations you have in trying to understand that and model it. In terms of premium financing, good question. So actually just 2 days ago, our highest governing body, the HLCG, the high-level consultative group of the Insure Resilience Global Partnership, endorsed principles for smart premium and capital support. Coming out of COVID, we recognize that evermore the fiscal space is very tight for governments to participate in disaster risk financing mechanisms, but we also recognize that this is an optimal way to support countries. So in order to support this push, we, the Insure Resilience Global Partnership, the Secretariat, have developed through a consultative process with our members, a set of principles to guide what that looks like. How do we ensure that premium financing and capital support contributes to a broader resilience agenda, a sustainable resilience building agenda? We will publish these if we have not done so already. The meeting took place 2 nights ago, quite late, but we hope that this would inform the dialogue over the coming year through the partnership and our members, and also our high-level consultative group, to really look at how we shape the global risk financing architecture, recognizing premium financing as an important pillar towards this. One final point, the nudge for this came from the G7. The ministers of foreign affairs met in the summer, the European summer in June, and they asked the Insurance Resilience Secretariat, the Insurance Resilience Global Partnership, to develop principles to guide greater support for disaster risk financing. So watch this space, join us. We'd really like to take this forward.
Yeah, thanks to that. I think the key in everything you said is the smart bit, right? And that's what I'm looking forward to seeing unpacked in your soon to be published note. Because if I can give a personal perspective, there are risks associated with premium financing, but there are clear benefits too. The devil's in the detail. It's all about how we do it, and do it in a way that's pro-poor, that's sustainable, that has impact in mind, etc., etc. And I think there is a gap, if you will, in the research or the policy guidance, because at the moment the debate is a little bit stuck on should we, shouldn't we? But actually the answer is we should, but how? And hopefully you're going to be filling that void. My running order says we're at time, and I want to just make sure I haven't misread the running order, because I think we're supposed to wrap this up around 1:15 Central European, and my clock is telling me that we're about that point at that point now. So I'm not going to offer any closing remarks. But I wondered, I can see that Claire's typing, but I wondered whether Claire or Amjad, whether you wanted to just offer a minute closing reflections on what's been discussed so far. And you can pick up on the premium financing piece. You can pick up on some of the questions around social protection versus insurance in the chat, or anything as you wrap this up.
Amjad, I'm happy to give you the floor.
Yeah, thank you very much, Claire. First of all, I would say that, Daniel, that we should not see heat wave in isolation. Mm-hmm. Heat wave are certain indication of other hazards like drought and forest fire. And designing our interventions have to be very, very localized, because as we pointed out, and we have seen with experience, that within one country, even within one province, there are different dynamics and different dynamics of the communities and what response needs they have. So designing a response, whether it is around this mechanism or that mechanism, totally depends on the needs of the communities, how that community needs and how it is being designed. So I would say the solution lies in localized response mechanisms made by the local organizations, which have to come up from the local partners who are working on ground and have been working on ground. And just looking at the heat wave, because as we have seen in the history that heat waves are short-lived, they tend to come for a week, 10 days time and then wither away. But these have given us a deep insight that during this season, we responded to 4 heats, and we are already looking towards a very lean monsoon and very high risk of drought this coming summers. So we have to see this overall picture in the perspective that this insurance mechanism is not just for heat wave or heat stress, but overall insuring people against certain hazards which are going to ensue after these heat waves. Thank you very much.
Thank you very much. I'm going to double down on the 3 things that I heard there. No location is single peril. Every location experiences a multitude of potential hazards, and we cannot look at heat in isolation. Yes, resilience is situational always. You can never copy and paste from one location to another, and you need to understand the details. And thirdly, the issue is not the heat. The issue is not the flood. The issue is what comes from the heat and what comes from the floods. And that's what it is we should be insuring for in the broadest sense of the word insuring. We need to wrap. It remains only for me to thank my colleagues. It's been an honor to be with friends, some very old, some very new. Amjad and Claire from the Start Network, thank you very much for your perspectives. Very, very insightful. Kshitij, lovely to have you with us. Thank you for bringing your perspectives all the way from India. And Kathy, always a pleasure to duet with you. Keep up the good work, everybody, and driving the resilience agenda forward. The main session recommences shortly. So those of you that wish to transfer over there, please do so. Thank you for being with us. That's all from me. Bye, guys.
Bye. Thanks, everybody. Thanks for the conversation. Bye-bye.
Bye, Kathy. Cheers,
Bye.
Claire. Bye,
Thank you.
Kshitij.
Thank you. Bye-bye.
Bye.
That's
Bye,
you.
Amjad sir. Bye, Kathy. Bye, Claire.
Amjad and Claire, I'd love to be in touch.
Sure, sure.
Great. Okay. Kshitij, nice to see you. We'll be in touch. Okay.
Sure, sure. Thanks again,
Okay.
Kathy.
See you